Okay, it's recording now. So what brings you in today?
My forearm hurts.
Um, do you have do you know how it happened?
Um, it's just kind of happened over time. I mean, at my job, it begins to hurt, and I just kind of keep pushing it off, and it just happens like throughout the day, but not necessarily like at a certain time.
So there was no specific event that happened to make it hurt?
No.
Okay. Can you describe the pain? Is it sharp, dull, achy?
It's kind of like a nagging, but it can be sharp.
Okay. Um, if you can lift up your arm and point to where it hurts the most.
Um, right here,
On the outside or the inside?
the outside.
Okay. Um, Do you ever hear any sounds like cracks, pops, clicking, any of that?
No, I don't hear any of that.
Okay. Do you play a sport?
I do not play a sport, no.
Okay, what do you do for your job?
My job is I am a waiter at a very high-end restaurant.
Okay, so do you carry your trays around like that?
Yes, I do.
Okay. Um, have you ever hurt this forearm before?
I not this one, but a couple years ago I had carpal tunnel syndrome because I was a tech guy.
Yeah. In the same arm or both of them?
Just in my left. So my right one hurts right now, but my left one
Okay.
currently.
Um, on a scale of 1 to 10, 1 being no pain, 10 being the worst pain you've ever felt, what is it right now?
Um, well, when I'm not working, it's like a 2 or 3, but when I work, it jumps up to like a 7.
Okay. Have you tried anything to make it better?
Yeah, I will. I'll ice the spot for 15 minutes if it hurts, and if it's unbearable, I'll take like an ibuprofen or an Advil.
Does that help?
Yes, it does. It relieves the pain for a little bit.
Okay. Does anything make it worse?
Um, Not necessarily. No, it's just when I work, it hurts.
Okay. Have you have had any recent increases in the amount you worked or changes in your activity?
No, not at all.
Okay. Uh, and you don't wear any braces or have any support that you use for it?
No, I do not.
Um, have you had any treatment so far, or is this the first person you've seen?
You're the first person I've seen.
Okay. Do you have any relevant medical history in your family, such as diabetes or any other relevant medical history?
I do not know.
Okay. And other than the anti-inflammatories, such as the NSAIDs, do you take any other medications?
No, I do not.
Okay. Um, how long has this been going on again?
This has been going on for like 2, 3 months now.
And has it gotten worse? Is that why you're coming to see me? Is it getting worse?
Yeah, it's really starting to bother me now.
Does it ever wake you up at night?
Um, no, it does
Okay.
not.
Um, for now, I'll come back if I have more questions. So when I look at it, so upon observation, is there any swelling?
There's some slight swelling, but
Okay.
not
Is there any
extensive.
bruising?
No bruising.
Okay. Um, Yes, is there any redness?
No.
And when you come in, are you self-splinting or holding it different than the other arm?
Um, no, not necessarily.
Okay. So since we're on telehealth, I'm gonna have you kind of palpate your own arm and tell me if you have any pain, and I'll describe where you're going to touch it. Okay.
Okay.
So we're gonna start down at the wrist because you don't have much pain down there. So if you're gonna touch on the outside of your wrist, you're just gonna palpate around that bone you have right there. Does that hurt at all?
No, I have no pain with this.
And then let's switch to the other side on the thumb. No pain with that.
No pain.
And then we're gonna slowly move down your arm and you're gonna feel for your bone in there and just palpate it slowly and press and then tell me when it hurts or if it hurts.
It does not hurt on this side, no.
Okay. And then when you get up to your elbow, you're gonna feel like a crease right there, like between your elbow, the bony part of your elbow, and then the other bone. So you're gonna go in the middle there. Does that hurt at all?
No, it does not hurt.
Okay. And then we're gonna slowly move over. You're gonna press on the back right below that bone. Does that hurt at all?
Nope.
And then as we move over here, you're gonna feel for your next bone. Does that hurt?
Not really. I mean, it's a little uncomfortable, but
Okay. And then we're gonna slowly move up. So you're gonna, let's start actually all the way up here at your tricep, so back here. And then you're gonna move all the way down using like your fingertips to press into that muscle. Good. And then move slowly to the outside of your arm. So if you're going down, so now you're at the front where your bicep is,
yep.
all the way down to where your elbow bends. Does that hurt at all?
Nope, no pain with that.
Okay. And then start moving down the side, like you're going to be on the outside of your arm, and then move down to where you like experience that pain normally. So yeah, I can't. Okay. You're gonna start on the outside of your elbow all the way
Ooh,
up, like down.
yeah.
Does that hurt?
Start up. Okay, so it hurts like right here.
Okay. And does it move down? So continue to move down your forearm. Where does it stop hurting?
It stops probably like midway.
Okay. And so then we're just gonna go right back to that bone up there on the outside of your elbow.
Okay.
Does it hurt right around there?
Yeah, a little bit.
Okay. Should be it. And if we now do it in a completely bent position, does it hurt more or less when you're palpating around that area where it hurts? Or is it the same?
It's about the same.
Okay. And then which motion hurts the most when you when you bring it all the way up or when you bring it straight? Or neither?
Straight out.
Okay. And then if you're moving your arm, like you're flipping your palm back and forth, does that hurt?
No, I have no pain with that.
Okay. So now we're going to move on to your range of motion. Obviously, we're not going to actually measure it because we don't have a ability to do so. So we'll start with the shoulder just to make sure everything's good there. So first you're going to bring your arm all the way up to your head. And then you're just going to show me like the difference bilaterally, right? Just in the scenario.
Okay.
Yeah. So bring both of them up. And then you can bring both of them out and all the way up. So start down and then bring it all the way up. And then can you do the same thing but bring your arms backwards? So start down and then, yeah, and then bring them back like that. Yeah, okay. And then if you bring your arm up like this and then bring it in without moving this part of your shoulder. So you're just moving your arm. Good. And then the same thing, but bring them back. Okay. We're going to move down the arm now. So we're going to look at the elbow and the wrist. So you're going to bring your arm all the way as far as you can, like this. Is there any differences?
No.
Okay, and then extend them all the way out. Any differences?
No.
Okay, and then we're just gonna, so you're gonna, okay. You're going to start like this with your hand out like that, and then bring, like, hold on to your elbow with one hand. So we're gonna do it separately here. And then bring your forearm as far as you can over. So you're, yeah, palm down. And then go back to neutral, so in the middle, and then bring it all the way to palm out. And then you can switch to the other side. Okay, does any of that bother you?
When I was like this,
That hurt on the outside?
yeah, it was uncomfortable.
Okay, but it's normal range of motion wise?
Yes.
Okay. We'll just go down to the wrist just to be thorough. So you're going to take your wrist and you're going to bend it all the way up and then extend it all the way back.
That hurts.
Where?
Right here.
Okay. And then we did that one. So now you're just going to bring your hand in. So you're going to keep your hand straight and then bring your thumb towards your arm. Yep. That one works too. Yeah. And then opposite way, pinky towards your forearm. Does that hurt?
The thumb one hurt a little bit
Okay.
towards the forearm.
Okay. I'm just gonna write some things down really quick.
Yeah, that's fine.
Uh,
I'll probably do the same with you anyway, so.
yeah. So extension hurt when you bring your arm all the way out. Did that hurt? When you did it straight?
Yeah.
That hurt?
Yeah.
And then when you brought your palm down?
What do you mean when I brought my palm down? Oh, yeah. Yeah.
That one?
Yes,
That one hurt?
Yeah.
And then wrist when you brought it back like that? Or this one? Okay.
No.
And then the last one was when you brought your pinky towards your, or was it your thumb?
My thumb.
Okay. So now we're gonna attempt to test the strength of your muscles. So this will be weird because you're gonna try to do it on yourself. So we're gonna start with the elbow. Since you had no problems with range of motion in the shoulder, we're just gonna start with the elbow. So you're gonna bring your arm all the way up, and then you're gonna put your hand on the other side and you're gonna push into it as hard as you can. Does that hurt?
No.
Now switch arms and do the same thing. And from now on, let's start with the uninjured side first. Sorry. So extension, you're gonna bring your arm all the way out with your good arm. And then you're gonna push into your arm on the opposite side. So you're gonna stick your hand underneath and you're gonna push into it. And then we'll switch to the other side. Does that hurt?
No pain.
Okay. Now let's see. So now you're going to bring your arm. So you're gonna bring your arm out, and then like you're giving yourself a handshake. It's weird because you can't. You're gonna try to bend your arm. So you're gonna keep your elbow at your side. Sorry.
Yeah.
And then you're gonna push into your own hand by like gripping it around your wrist, and you're gonna push it outward like you're trying to put your palm to the sky.
Okay.
But like put resistance against your hand that's trying to turn it. And then you're gonna do the same thing on the other side. Do you have any pain with that? Never mind. Let's try it on the bad side. Do you have any pain with that?
No, I do not.
Okay. 1 second. And then now you're going to do the same thing, but you're going to be trying to push your palm down, keeping your elbow at your side. You're going to push your palm down. And then same thing with the other side. Make sure to be providing the resistance. Does that hurt?
Yeah, that one was uncomfortable.
Okay. Now you're going to have your arm. So you're going to have your palm to the sky and you're going to be pushing into your other hand. So here we're testing your biceps. So you're going to push into this hand and you should feel it in this muscle up here. Good. And then we're going to switch arms. Press into that one. No pain.
No pain.
So we normally would test your triceps on your stomach, but since we can't do that, we're going to have your arms straight out and you're going to have your hand under close to your elbow. Wait, on the other side, sorry. So up here. No, 1 second. Yeah, so your arm's going to be underneath and you're going to press into your hand underneath as hard as you can. Same with the other side. Does that hurt?
That did not hurt.
Okay. Last one for the elbow, you're going to have your palm neutral. So you're just going to be out like you're shaking, you're doing a handshake. And you're going to press down on that. So it's almost the same as the biceps, but your hand's just up like this. And you're going to push down and testing the brachialis muscle. And then same thing on the other side. Does that hurt?
No, no pain.
Okay, and now we're going to move to the wrist. So you're going to bring your hand all the way up. And then you're going to try to push down with your other hand. Yeah, like that. So you're just, yeah, so just your wrist. So you're going to keep your elbow flexed. And then same thing with the other side. Okay, no pain. And then now you're going to have your wrist extended like that, and you're going to try to push it up. No pain.
That one hurt.
Is it weak as well?
Not so much weak, it just hurt.
Okay. So now we're going to bring your, like this. Yep, and then you're going to try to push it back out. Good. And then same thing on this one. Did that hurt? No? Okay, so back to this hand, you're going to bring your thumb to that direction now, which I can't really do. And then push it, try to push it to that direction. And then same thing on that side. Did that hurt?
Yeah, that
okay. Okay, so now we will go to the neurological screen. If I could have you stand or just back up some, probably would be best, if you can. So now we're going to test your sensation to see if there's any differences. So instead of me running my hands across the different areas, you're going to do it. And you should just tell me if you feel a difference bilaterally or difference between one side and the other. So if this side was to say like tingly and this side wasn't, you should tell me. But you should also just tell me if you have tingling, numbness, any weird sensations that aren't normal to you.
Okay.
And we'll go from there. So we'll start with, I'm going to tell you each nerve root that we're testing, which is like the nerve innervates where your sensation is. So you have nerves and they go to here and they go to here. We're going to start with C4 and you're going to touch just your top of your shoulders and the front of your chest like that. So just like that. Good. Any differences?
No, they're the same.
And then we're going to go to C5, which is going to be your upper lateral or outside of your arm. So we're going to do those. The ones from now on are going to be one side to the other because we can't do them at the same time. So you're going to start right up here and you're going to go down to about your elbow. And then the same thing on the other side, just on the outside. Yeah, like that. So for reference, we're going to have you, I'm going to try to stand up. I'll put it on the cat tower. Okay, so you're going to have your palm out like this. So your thumbs are going to be out. And then, so this is going to be C5 right here.
Okay. Can you see me still?
Okay. There.
Can you see me still?
Okay, so right here. And then to the other side. And then we're going to move to C6. So now you're going to be at the lower part of your forearm, all the way down into your thumb and your first finger. So you're going from here to there. And then same thing on the other side. And then C7, you're just going to be at your middle finger up into your palm. That's it. So just middle finger to palm on both sides. Do you feel any differences in any of those yet?
No.
Okay. So now C8, you're going to have your little finger and your ring finger up to your elbow. Okay, same thing on the other side. And then last we have T1. So you're gonna have your upper inside of your arm up to your right below your shoulder. So kind of like your armpit region. And then the other side. Do you feel any differences with those?
No.
Okay, so now we're going to try to test the strength of those muscles that are innervated by that. So first you're going to shrug your shoulders one at a time because we can't do two at a time and press down on it. Good. And then same thing on this side and press down. Next, you're going to bring your arm out and press down on it. Good. And then press down. And then we're going to bend the elbow up and the wrist back. So we're like this. And then okay, we're actually going to do it one at a time. So you're going to bring your elbow up. You're going to press down on it. Hold, hold, hold. And then you're going to bring your wrist back, like this. And then press up on it. So you're like extending your wrist back and pressing up on it. Good. And then same with the other side. Next, you're going to bring your elbow all the way straight and try to press it up. This is C7. So you're going to have it under your forearm down here. And then press up. And then your lower part below your elbow. And then press up. And then this time you're going to flex your wrists like that. And then you're going to press one of them up at a time. So try to push it to the sky. And then same thing on this side. And then you're going to put your finger and your little finger and your thumb together. And the best you can, you're going to try to separate them. So first try to pull on your thumb and then on the little finger. And then same thing on the other side. That's T1. Oh, that's T8, excuse me. And then last T1 is going to be, you're going to bring your hands, your fingers out as far as they go, and then you're just going to try to squeeze them together. And then you're going to bring them together and you're going to try to pull them apart. But make sure you're trying to like hold your fingers in. So yeah, like that. And then you can switch to the other side when you're ready. Okay. And that's it. I mean, we would test the reflexes, but we don't have a reflex hammer and there isn't really a way to test your own reflexes. So I'll just verbalize for C5, it would be the biceps. There's none for C4. There's the radial for C6. C7 is the triceps, and then C8 and T1, there aren't any. So now I'll move on to what the 3 different things I think it could be. So 1, I think it's lateral epicondylitis, just because of the pain presentation. You could also have a, let me think, pronator strain. So pronator muscle strain, just because it hurts with pronation, hurts with the pronator muscle test as well. And then third, let's see. I guess it could be a stress fracture just because of the repetitive motion that you are doing at work. So those would be the 3 that I think. So it would be a stress fracture of the lateral epicondyle, I guess. But definitely I'm leaning towards number 1. So my assessment would be the injury would be lateral epicondylitis. And then for my plan of treatment, I would say rest. So if possible, we would have you start to carry the food a different way, like get accommodations at work. I know that like you're a fancy waiter and that's how you're supposed to carry it, but we would get some accommodations for a while to help that calm down. And then also starting rehab to strengthen those muscles that allow you to do that work. Because when you have lateral epicondylitis, it hurts with extension and it hurts with deviation, radial deviation. Yeah, radial deviation and then extension. So if we start to strengthen the muscles that do that, you're going to have less pain when you do that. And then I'd say keep taking NSAIDs because it's going to reduce the inflammation. And we'd slowly increase back to holding it like this after you start gaining that musculature that it's going to allow you to do that without getting that pain in like your tendon and stuff like that. And then we can refer to rule out stress fracture, and just to be safe, get x-rays. But my likely treatment would be rehab to strengthen things to get the pain down, such as ultrasound, that kind of stuff, e-stem, and then get you back slowly after you start strengthening things. Okay, I'm done. Was that correct?
It was correct.
Okay, thank you. Wonderful. Thank you.
I'm actually curious if I need to go as in depth as like that whole screening, because like I mean when you work with patients, and I know this is obviously recording, so
Yeah, that's okay.
usually like I don't know if I see something and I know like kind of what it is, I just kind of like just target that. But I know this is like
Yeah.
standardized patient, you have to run through everything.
Yeah, I didn't know either, so I just kind of did, but I don't know how long. I know that there's like a limit on this because like we don't have like a actual plan. Like if I think it's 40 minutes. So I don't know if you wanted to like make your own Zoom meeting if you knew how, because it might like clock out.
Well, how far along are we?
I don't know. I think we got on here at 15, probably 20. It's
Um,
been about 30 minutes already.
uh,
Actually, you can't do that because then you wouldn't have my evaluation.
yeah, true.
So let's just go and hopefully that doesn't happen.
All right, speed run.
You don't have
Okay.
to. Just I don't think it might not happen, so take your time.
Okay. Well, I mean, if it does, I want to not have to redo this.
Yeah.
Especially if, like, I'm already like close to my assessment and then I like change everything. But hi, my name is Frank. How can I help you today? What's wrong?
My knee hurts.
Your knee hurts. What happened?
I was lifting in the weight room. I was doing let's see here. A hang clean, so I like came up and as I came up with the bar, my knee like kind of it felt like it hyperextended and I just felt like this clunk noise as like it felt like my bones were hitting each other and it just hurt immediately after that.
Oh, wow. Are you? And when did this happen?
Um Yesterday.
Okay. And is there like any swelling or anything like that? Like, is there anything bothering you right now?
Right now it just really hurts and yeah, there's a little bit of swelling, but when I'm like walking, I feel like it's gonna give out, but it hasn't like actually given out.
Okay. And then where's the pain located?
It's this is gonna be hard. It's all in like the front of my knee. Let's see if I can.
Is it on the front outside or the front middle?
So it's like right in here.
Okay. And how would you describe that pain? Like on a scale of 1 to 10, 1 being like I'm okay, and 10 being I have to go to the hospital right now. Let's cut this thing off.
I'd say like it's a 4. Like I feel like I can compete, but it just doesn't feel good.
Okay. Have you ever injured this leg or like this area before?
No, I have not.
No, perfect. What does it like hurt going upstairs or like just regular walking throughout the day?
Yeah, when I go upstairs, it feels like there's like pressure in my knee, like something's like kind of pressing together on some structure and making it hurt. And when I walk, it's okay, but it feels like it's gonna like give away all the time.
Okay. Um, do you take anything for the pain?
I tried taking some anti-inflammatories, but it helps for a while, but then it just comes back.
Oh, okay. So the pain, like, does the pain go away kind of at night when you're not like walking on it or anything like that, like when you're laying in bed?
Yeah.
Okay, perfect. Um, I have another question for you if I can't remember right now. If I have any more questions, I will ask you as I continue.
Okay.
So let's just start with palpation. Is there like any gross deformity such as like redness or is you're out obviously nothing sticking out of you, so is it red, is it swollen?
It's swollen, all like right in the joint line, so like right through here.
Okay. um is there any numbness or tingling?
No.
Okay, perfect. All right. So I'm gonna try and bring my knee up here and see how this goes. Yep, might not be able to do this. I'll just stand up.
Okay.
All right, so let's start away from the injury.
Okay.
Nice, like my holiday socks, pretty cool. Uh, you have two little balls down here in your ankle. Those are your malleolus. Can you uh, touch around the one on the outside of your leg? Do
Okay.
you have any pain with that at all?
No.
All right, perfect. Can you follow that ball all the way up to your kneecap? There should be like, it should be really hard. And if you just follow it all the way up, that's your fibula. And is there any pain with palpation along that?
No.
Perfect. And then if you go all the way back down to your ankle, go to the inside. And that's also your malleolus. That's your medial malleolus. Any pain with that at all?
No.
Okay, awesome. And then if you follow that all the way up, you're going to be following up your tibia. Any pain?
No.
Okay. Go right down the middle of your shin and feel that nice bony prominence. Is there any pain along that at all?
No. Just like a little bit at the very top.
At the very top. Okay. What was that? Was that me?
No, that was me. Sorry.
No, it's okay. All right. Now let's feel for the gastroc or the calf muscle. You can
Okay.
start at the bottom. Your Achilles. Is there any pain with that at all? Right
No.
down here.
No.
Perfect. And then if you squeeze up the calf, is there any pain with that at all?
No.
All right, awesome. Now let's go to your kneecap itself. If you play with your kneecap, you probably can't play with it now, but if you touch your kneecap, is there any pain at all?
Right below it.
Right below the kneecap? Okay, but nothing on like the sides at all?
No.
Okay. What if you go above the kneecap? Is there any pain with that at all?
No.
Sweet, and if your pain's all located there. How about the top of your like thigh? There's that muscle right there. If you palpate that at all, is there any pain?
No.
Okay, perfect. Let's go into range of motion now. So what I'd like you to do is extend your leg out straight. Do you have any pain with that at all?
Yeah.
Yeah, where's the pain located?
Like right in here. It
What does it
feels
feel
like
like?
it's pinching.
Pinching, okay. And you said you felt like a click or like a clunk when you
Yeah, when I first did it, it just felt like my bones were hitting each other. So it was like a clunk.
okay, but was there like a pop?
No.
Okay. Um, can you, to the best of your ability, can you kind of like grab your knee and like bring your ankle to your butt? Does that hurt at all?
No. Well, I guess tiny bit in the front when I get to like the very end.
Okay. Um, Kind of like move your foot and kind of have your toes pointed towards your other leg to the best of your ability.
Okay, I'm doing it. Yeah, it's happening. I'm doing it, but you
Is
just
there any
can't
pain?
see it. It doesn't hurt.
Doesn't hurt. Okay, now have your toes point the other way and have your knee straight.
Um, no, it doesn't hurt.
Awesome, perfect. All right, now what we're gonna do. Ooh, how are we gonna do this? I'm gonna stand back up. MMTs for you. Stick your leg. All right, let's see. No, do you have like a table or like a couch anywhere where you could kind of put your leg?
Yeah. I like that? Yeah. Okay, let's see.
Yeah, just like kind of like straight up, not on it, but like by it, like above it,
Okay.
kind of slightly above it. Now I want you to, with both of your hands, push your leg down, but I want you to try and resist it.
Okay.
Is there any pain with that at all?
Yeah.
And where's the pain?
Right in that same spot right in here.
Same spot. Okay. Bring your ankle towards your butt again, and put your hand behind your ankle, like by those two balls again, and try and extend, like it, make your leg straight again, but resist it. Okay. Any pain?
No.
Perfect. All right. Stand up for me real quick. And what I'd like you to do, if you have something to hold on, great, but if you don't, that's fine. I'd like you to stand on one leg, and I want you to just twist your hips. Keep your stationary leg straight and just twist your hips a little bit. Did you have any pain with that at all?
No.
Really? Okay. You can go ahead and sit back down. If you push your bad leg, so if you're by a wall or a couch or something, have your foot stick straight out like this. And with your foot like pushed up against that table nice and tight, try and twist your leg around a little bit. I don't know, it's kind of hard. I'm trying to do Apley's compression, but I don't think it's working.
Yeah.
Would there be pain with Apley's compression?
No.
Okay. You can rest your foot again on that table. As relaxed as you can possibly be. Can't see much. Just try moving around your patella. If you're relaxed enough, you should be able to move it side to side, up and down, all that.
Yeah.
Do you have any pain when you're moving that?
A little bit, but not much.
A little bit, but not much. And where's the pain?
When I do it,
Yes.
like right underneath the patella.
Okay. Is there a bony prominence sticking out in your shin, kind of by your patella?
No.
Okay, so it's not oscar. What else can I do? Would I mean, I can't do a Lockman's, but would a Lockman's be negative?
Yes.
That's what I thought. It's tough because the knee is mostly like ligamentous.
Yeah.
All right. Well, if I'm, can you do a valgus? I don't think it's possible to do valgus or varus, but I don't think that's necessary. My three assessments, or my two assessments really. It could be patellar, femoral, or you could just have like tendonitis in your patellar tendon. I think that's definitely a high possibility. But due to what you've told me, with your clunking and you feel like bones are pressing up against one another, I'm guessing a tear to your meniscus.
Okay.
My second and my main assessment, because like if you don't have, my third one I guess would have been Osgood Slatters, but you already told me that you don't have a bony prominence sticking out very far. So based off of my assessment and what you've told me in your history, which from what I know is one of the most important parts.
Yeah.
I'm guessing a meniscus tear. Oh, and my plan, I don't know if I need to do this or not, but my plan, I guess depending on how bad it is, surgery definitely might need to be required to fix that. And once that's done and over, I would work on strengthening the hamstrings and the quadriceps, as well as potentially maybe the gastrocnemius as well.
Okay. Yeah. I mean, it was a fat pad impingement, but because we learned about that so much. So I guess like maybe you guys didn't, but we like took a lot of time on that. So
Yeah, no, I mean we did, but like the things that stick out to me the most were like the more common ones, I guess. You would
yeah,
see.
I think I can stop recording now.
Yeah.